Hi, it's Cindy, the Executive Director of the Osterville Library, and we're back with our interviews again. And today we are so happy to have with us Joseph Camelio, the Executive Director of Urgent Care Services for Cape Cod Healthcare. Joseph has held this position since February of 2022 and has worked in healthcare for over 20 years. His experience spans time spent working in the clinical capacity in the emergency department of various managerial and professional roles. He is here with us today to discuss and answer common questions regarding urgent care and what makes Cape Cod Urgent Care Center so unique. So Joseph, welcome. We're so glad to have you today.
Oh, thank you, Cindy. I really appreciate the opportunity to collaborate and discuss urgent care with you, and excited to answer some questions.
Great. Well, we're so fortunate to have Cape Cod Healthcare here and internationally recognized, I believe, for its care. So we're here to talk about urgent care. So can you tell us what exactly is urgent care?
Yeah, that's a great question. One that seems simple, but the fact is that there's a great deal of variability within the industry in terms of the structure and capabilities from one center to a next. But generally speaking, urgent cares really provide immediate walk-in medical services for acute, non-life-threatening medical conditions. If you were to look at the care continuum, they really filled the void between your primary care provider and the emergency room. And they really provide access in a healthcare environment that desperately needs more access. So that's really kind of the role that urgent care plays.
Well, so what are the benefits of going to urgent care? I know we're so lucky here to have the beautiful new John and Marjorie McGraw complex, and the urgent care is seasonal here, but what are the benefits of going here as opposed to going elsewhere?
Absolutely, yeah. So there's a lot of benefits to urgent care, but I think really when you look at it, there are two main benefits of utilizing urgent care, and that's convenience and cost. From a convenience perspective, services are offered on a walk-in basis, which means that you can seek care when it's convenient for you. Oftentimes hours are offered into the evening or on weekend hours beyond what your primary care provider typically is open. And then for us specifically at Cape Cod Healthcare, 95% of our patients are out the door in under an hour. So that's a considerable time savings for the patient. In addition to the 6 centers that we have strategically located throughout Cape Cod, which offers multiple access points and the ability for anyone on Cape Cod to access urgent care within 30 minutes of their home. And I think additionally, with that being part of a health system for us, we have great synergies within the health system. So if you were to be seen in an urgent care, there's tremendous communication with your primary care provider, if your primary care provider is within the health system, to aid in that continuity of care for further follow-up and things of that nature. So really the convenience part is huge for patients. I think that's critical in urgent care. Second is the cost component. There was a study done a few years back that said 27% of cases in the emergency department could have been handled in urgent care. Now that's really important because the estimated range in terms of cost savings in urgent care versus the emergency department is between $225 and $585 per visit. So that's a big amount. So there's really considerable cost savings for the healthcare consumer when they utilize urgent care for the appropriate reasons. So I think those are two of the biggest factors and benefits and advantages of urgent care.
Okay, so going off what you just said, so what conditions are appropriate for going to urgent care as opposed to going to the hospital?
Yeah, absolutely. So there's a wide range of conditions that urgent cares can treat. They can range from orthopedic injuries, say you spray your ankle or hurt your shoulder. We do a lot of laceration repair and wound care. And then we obviously treat things like coughs, sore throats, urinary tract infections, rashes, tick bites, things of that nature. So it's really acute, episodic, non-life-threatening type conditions that are very well suited for us to treat in urgent care.
Okay, so I know this is getting into summertime now. We have new second homeowners, people that have moved here, visitors. So do you need an appointment or do you have to be part of Cape Cod Healthcare to use the urgent care?
Great question. Yeah, so we're a walk-in basis, so there's no appointment, there is no referral needed, nor does your provider need to be associated with Cape Cod Healthcare to utilize our facilities. We're there to really be the health safety net for the community, our year-round residents, visitors alike. And if you need us, anyone can visit any one of our 6 locations and come on in. We're happy to help.
Wow, that's great. So how does insurance work? Will it cover the cost if I go to an urgent care?
Yeah, so we do accept all major insurances, but we do recommend that any patients that have questions surrounding coverage, you certainly should call the customer service line on the reverse side of your insurance card. That way you can kind of get a better sense of your specific coverage for your plan, and determine, you know, what that cost will be. And then additionally to that, there are some services that aren't covered in our place of service in urgent care, things like preventative medicine, or asymptomatic screening, those types of things. So again, if patients have any kind of questions, they should certainly reach out to their specific plan, to get answers surrounding coverage and things along those lines.
Great. So I feel I have a condition that might be right for an urgent care. What would my visit typically look like?
Sure. So when patients come into our urgent care centers, they're greeted by one of our receptionists. The receptionist takes some, you know, basic demographic information. They'll verify your insurance. They'll collect any copays that may be due. Once that short process is completed, one of our nurses or techs will take you back to an exam room. They'll get your past medical history. You know, what medicines do you take? What allergies you may have, and then some specifics surrounding the reason for your visit that day, as well as some vital signs. When that's complete, one of our emergency trained providers will come in, they'll do their exam, and then they'll determine next steps, whether that be additional testing, prescriptions that may be needed, or potentially a transfer to another facility like the emergency department. And again, that all typically takes 95% of the time, takes less than an hour.
Wow, that's incredible.
Yeah.
So what is the difference between the urgent care and the emergency room?
Right, that's a question that we get quite a bit. The emergency room is really intended for life-threatening emergent conditions, things like heart attack, stroke, if you have abdominal pain, due to the fact that they have more robust diagnostic capabilities. They have things like CAT scans, ultrasounds, the ability to get lab work back very quickly, where the urgent care, we have emergency room trained providers, but we just don't have those resources, those diagnostic resources. So we're better suited for things like we just discussed, the coughs, the sprains, the sore throats, the tick bites, things like that, that you don't have to go to the ER and incur that expense and incur that weight, that we can take care of in the urgent care center.
Oh, that's great. So what is the difference between going to urgent care and my PCP?
Sure. So PCPs their visits are typically based on appointments as opposed to walk-in. That's probably the number one difference. Secondarily, I think with the primary care provider, they typically have a longitudinal or long-term relationship with their patient. So they're really better equipped to manage chronic conditions, to manage your prescriptions, well checkups, yearly physicals, immunizations, things of that nature, that aren't great for urgent care. We take care of those acute episodic type of things, whereas the primary care would take care of your chronic conditions.
Okay, that's interesting. So we know there's the Cape Cod Healthcare urgent cares, but I think there's a couple other urgent care type places on the Cape. What sets Cape Cod Healthcare urgent care apart from these other ones?
Absolutely. So, Cape Cod Healthcare urgent cares are really unique. And I think that's really based on the fundamental ethos and the commitment to quality that we have organizationally. I think that's reflected the moment that you walk through the door. I think you can appreciate the design and the thought that goes into our facilities. And I think furthermore, it really goes on to our staff. It's our receptionists, our techs, our nurses who all do tremendous work. And then it's our emergency room trained providers that really sets us apart and differentiate us from the rest and allows us to provide a quality of care that's second to none. Having emergency room trained providers in the urgent care is a very unique thing. And I think that's the number one thing that sets us apart. And then I think secondarily, it's really our commitment to the community, right? One of our taglines in urgent care is minor emergencies and major attention. And I think that's really what we strive to do is to provide a great service with great quality. And I think particularly locally, that's what sets us apart. But I think even more so, it sets us apart from the vast majority of urgent cares out there.
Wow. It's really great. We're so lucky to have all these urgent cares on the Cape and Cape Cod Healthcare. So if somebody was here and wanted to learn more about Cape Cod Healthcare's urgent care centers, how would they do that? Is the website
Yeah, absolutely. They could visit capecodhealth.org, where they could get information on all 6 of our urgent cares, where they're located, their hours of operation, as well as estimated wait times, and just a lot of other useful information regarding urgent care. And then if they were unable to find the information that they need there, they can obviously call any one of our offices, and one of our team members can certainly help with any questions that they may have.
Oh, that's great. And all I hear is wonderful things about the John and Marjorie McGraw Urgent Center and what a great experience everybody's had who's used it here. And we're so lucky to have it. I thank you so much for being here today. Is there anything else you'd like to add before we close out this session?
I just wanted to thank you again. I really appreciate the opportunity to discuss urgent care with you, and really glad that we have the collaboration with you in the Osterville Village Library. And just very grateful to discuss this with you today.
Well, thank you so much for joining us.
Great. Thank you again.